With COVID-19 present in Washoe County, we're launching our first You Ask, We Answer segment, taking your top questions about COVID-19. With me today is Dr. Randall Todd, Division Director for Epidemiology at the Washoe County Health District. Thank you so much for being here, Dr. Todd.
Thanks for having me.
So we have a lot of questions out there, understandably, from our community. So let's start with the first one, which is, how do I catch COVID-19?
Coronaviruses, of which COVID-19 is one, are generally thought to be spread from person to person through respiratory droplets. So if I cough, I'm generally going to put some respiratory droplets out into the air, and they will generally sort of hang in there about 3 to 6 feet. So as long as if I've got it, as long as you stay further than 6 feet away from me, you're unlikely to get any of those droplets because they're going to fall down to the ground.
Which is why we've been hearing so much about the social distancing, staying 6 feet away.
Yes, that's exactly right. So currently there's no evidence to support transmission of COVID-19 associated with food, which is good for people to know.
Very good.
However, before preparing or eating food, it is important to always wash your hands with soap and water for about 20 seconds. Or that's about how long it would take you to sing happy birthday a couple of times. Anyway, throughout the day, you should wash your hands after blowing your nose, coughing, or sneezing, or going to the bathroom. And you should probably do that with or without COVID-19 being around.
That's just general good hygiene practices,
Yes, it is.
Right? We've been hearing a lot about hand washing, so I'm glad you reiterated that.
Yes. So it's also important to know that it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads. In general, because of poor survivability of these coronaviruses on surfaces, there is likely a very low risk of spread from food, products, or packaging that are shipped over a period of days or weeks at ambient, refrigerated, or frozen temperatures.
So then what is the top way of getting it?
Just being within that 6-foot range of somebody who's got it, especially if they're coughing or sneezing and putting those droplets into the air.
So that social distancing, keeping that barrier, the hand washing are really our best defenses.
Yes.
Okay, great, thank you. The other question we've been getting is, I don't have any symptoms, but I think I may have been exposed to the disease. What should I do?
One thing is to stock up on supplies and take everyday precautions to keep the space between yourself and others. As we talked about a moment ago, that 6 feet is kind of important. When you do go out in public, keep away from others who are sick. Limit close contact and wash your hands often. You should avoid crowds as much as possible. You should avoid cruise travel and non-essential air travel, because it's very difficult on an airplane to maintain that 6 feet of separation, especially with your row mates.
Near impossible.
Yes. So stay home as much as possible. Contact your healthcare provider to ask about obtaining extra necessary medications to have on hand. If you cannot get extra medications, then consider using a mail order for medications. And be sure you have over-the-counter medicines and medical supplies, tissues and so forth, to treat fever and other symptoms. Have enough household items and groceries on hand so that you will be prepared to stay home for a period of time.
So really, if people think they may have been exposed to it, even though they're not experiencing symptoms, almost best just to take the safe road and almost self-isolate, stay at home.
Yes.
To make sure that you don't spread.
Absolutely.
Okay, great. The next question, kind of the other side of that, is I do have symptoms of coronavirus, but I'm unsure if I was exposed to the disease. What should I do?
Well, stay home. People who are mildly ill with COVID-19 are able to recover at home. So do not leave except to go get medical care, and do not visit public areas. You should stay in touch with your doctor. Call before you get medical care, and be sure to get care if you feel worse or you think it is an emergency. You should avoid public transportation, such as ride sharing or taxis.
Thank you. So very similar approach.
Yes.
If you think you've been exposed or if you do have symptoms, really just attempt to self-isolate.
Yes.
Great. Another question with so many elderly folks who care for elderly, if I have a person who's considered high risk, elderly, or an underlying medical condition, what steps should I be taking to help protect them?
Well, the first step is to protect yourself, because if you don't protect yourself and you become ill, then you could transmit it to this high-risk person. You should call your healthcare provider if you have concerns about COVID-19 and your underlying conditions, or you are sick. You should follow CDC travel guidelines. You should contact your healthcare provider to ask about obtaining extra necessary medications to have on hand. You should be sure that you have over-the-counter medicines and medical supplies, tissues, etc., to treat fever and other symptoms. Most people will be able to recover from COVID-19 at home. You should have enough household items and groceries on hand so that you will be prepared to stay at home for a period of time.
So again, kind of the best message we can give people, if you think you're exposed, if you're around people who are vulnerable, if you are having symptoms, really stay at home.
Yes.
I think that's great advice. Stay home for Nevada. Another question. I'm concerned about having the virus, but my doctor's office won't test me. What should I do? What should folks do out there?
Well, you might want to consider consulting with your healthcare provider for more information about monitoring your health for symptoms that are suggestive of COVID-19. You should stay in touch with others by phone or email. You may need to ask for help from friends, family, neighbors, community health workers, etc. if you should become sick. You should pay attention for potential COVID-19 symptoms, including fever, cough, and shortness of breath. If you feel like you're developing symptoms, you should call your doctor. If you develop emergency warning signs for COVID-19, you should get medical attention immediately. In adults, emergency warning signs would include things like difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips or face. If you're not sick enough to be hospitalized, you can recover at home. Follow CDC instructions for how to take care of yourself at home.
Okay, great. Thank you so much. Any other last words of advice that you can give for our community?
Well, we just kind of touched the minimal surface of this topic with these questions, and I would remind people that you can go to the cdc.gov website, and at the very top of that you're going to see information about COVID-19. If you click on that, there is just a lot of information available there that you can read, and that is a reliable source for getting information. There are other sources of information out there that are less reliable, but if CDC has it on their website, then that is basically as reliable as it's going to get.
Great. And then of course, as you mentioned, keep your distance from folks, stay home, keep the hand washing, check in on your loved ones if you're able.
Yes.
Fantastic. Thank you so much for
You're
coming
welcome.
on and sharing with us. That is your questions you asked, we answered. Thank you so much for tuning in. And remember, you can always head to our website for more information. That's washoecounty.us/COVID-19.